that's where we're concerned, because that's the kind of transmission. I always have said, trying to stop influenza virus transmission like trying to stop the wind. We've never had anything successfully do that other than vaccine, and we don't have a vaccine here. So what's happening is that people in public spaces are getting infected. And the way you need to address that is, unfortunately, if you're older, over 55, you have some underlying health problems, which unfortunately a lot of Americans do. We have obesity. Then right now you don't want to be in large public spaces. You're trying to potentially get infected. So you can take care of that part. As far as what can public health do, we can talk about this. We're not going to have a vaccine anytime soon. That's happy talk. We can close schools. One of the big challenges we have right now, if we close schools, what do we accomplish? In influenza virus, when we close schools during outbreaks, because it turns out kids get infected in school, and they're like little virus reactors. They come home and they transmit it to mom and dad and brothers and sisters. And so we close schools sometimes. Christmas breaks are always great for kind of putting the dampening effect on flu. In this case, kids are not getting sick very often at all, which is one of the really good news features of this disease. In China, only 2.1% of the cases were under 19 years of age. And,
why is that?
We don't completely know. And I'm going to come to that in a second, because they're getting infected, it turns out. One study showed that they still get infected with the virus, but they don't get sick. And we have that happen. There's a disease called infectious hepatitis A, where we have outbreaks in daycares. And the way we know we have an outbreak is because it's transmitted through the stool, fecal oral, is mom and dad and the daycare providers all get sick. And the kids, those symptoms, we go in and test the kids, are all positive. So some diseases will manifest primarily when you're an adult, but not as a child. This one appears to be the same. So do we close schools or not, if we're not really spreading the disease? Because it turns out that if we close schools, a recent study done showed that 38% of nurses today in this country who are working in the medical care area have kids in school. And if suddenly we're closing schools for 2 or 3 months, who's going to take care of those kids? 1/4 of the American population has no sick leave. If we close schools, they don't get paid if they have to stay home.